Well, good morning.
Good morning.
Oh, you do better than that. Good morning. Good morning. All right, that's better. Let's try my going. I forgot how it works. It's laser. There we go. When we first started with Lean, we really didn't know what we were getting into. Harold came in, it was actually 4 years ago on December 7th, and presented the management team at Thomas Medical with a Lean overview. And that was the start of our journey. It's been a very exciting journey. It's been very rewarding and very challenging. Just a little bit about Thomas Medical. We were established in 1990 by a gentleman named Joe Thomas, hence Thomas Medical. Joe retired 5 years ago. Dennis Coons, our president, joined us then. He's with us today. Dennis, I'll be picking on you later. We're located in Malvern, PA. We have 170 employees. We run 3 shifts. 5+ a week. Lately, it's been 5+ a week. We were acquired by GE Healthcare in 2008, and that's been great. When we were first acquired, one of the folks from GE, who's been through a number of integrations, said to us that it's like drinking through a fire hose. We all laughed. We thought it was funny. Well, it's true. We're going through so many integration activities: new computer systems, phones, HR systems, finance systems, quality system integration, environmental health and safety. It's a lot to take on for a company of our size. But one of the great things has been, as GE is, they're very well established in Lean and Six Sigma. And for me, I was like a kid in a candy store. They have a whole site dedicated to it. So, myself and my staff, we were going in and looking at it and stealing and borrowing and getting a lot of great ideas. Our mission in life is to design and develop Class II single-use devices for our OEM customers. We have one sales and marketing person. We use our OEM customers like Medtronic, Boston Scientific, J&J, who have thousands of sales reps to sell our products. We focus on the introducer system, the catheter-based vascular access and delivery, where those companies, they look at the therapy, they look at the stents, the pacing leads, the pacemakers. We provide the delivery system for them. Our products are sold in more than 20 countries. This is one of our products, one of our main product lines. It's a tearaway safe sheath introducer. We've been manufacturing for this for a number of years, and it provides a hemostatic valve and a splittable feature. Prior to this device coming out, the surgeons actually had to put their thumb on the end of the cap to prevent blood from getting out and air from getting in. An air embolism is not a good thing you want going into your heart. And then they had to cut the sheath. So this problem, we have a patent on it, and our customer has a patent, so we're tied at the hips, solves that problem and really has taken off for us. This was one of the products that we first did a value stream map. Jeff Kapenis came in 2006, and we sat in a room, we did the value stream map, and it blew us away. We thought, we're not that bad. We can't be that bad. We sat back, and Jeff was really good. He calmed us down. He says, hey, this is normal. Don't worry about it. Let's identify the things we have to do. We continue to do value stream maps on this product line. We continue to do Kaizens. Our days of inventory have been cut in half. By next year, we want to cut that in half again. Our process cycle time has been reduced 30%. We reduced the number of direct labor people on the line by 25% and increased our output by double. And we're not done yet. I have a number of people in the audience here from the team, and we're just beginning. I won't sing that for you, though. I started and joined a company in 1998, and we were doing a number of continuous improvement projects, but they were mostly reactive based. You had a quality issue or a complaint or a scrap issue, we'd get a few people together, we'd go tackle it. And that, we did okay, but we needed something else. We started to look at some other methodologies, and so we knew we needed to get into a number of different aspects. We looked at Lean and Six Sigma, but our customers were asking us to reduce our costs, reduce our cycle times, and improve your quality. You've got to get better. And we heard them. And so we started our Lean approach with just going out to the manufacturing floor and getting the low fruit. When we came in, we started the journey. We did a cultural assessment through DVIRC, and that identified some opportunities for us. We knew one of the things was communication was a big thing. We needed some opportunities there. And also training. We didn't do a lot of training prior to, after I joined the company. So the people wanted to know the tools. They wanted to have the methods to do it. So that was an opportunity for us. One of the strengths they noted was our teamwork. We've always had good teamwork as an organization, and we're very proud of that. So, with the help of the team, we put the plan in place, and we started training people on the Kaizens, the 5S, the value stream maps. we did the Lean 101, and the introductory 5S, and got people there, and that was a lot of fun. A lot of our people have been to different seminars. We have 14 people that have been Lean Level 1 certified, 1 Lean champion. Myself, Brandon Beck, Kurt Hoover are here. We were the first 3 through the Lean Cert program. We were the initial drivers of it. We had to get on the bus, drive it, and start to bring it home. We're going to continue to use, even though we're part of GE and there's a lot of resources there, we're still going to continue to use the Level 1 certification and the other certification programs because we found them to be very successful for us. And again, we've got 14 people already through it. We're going to plan to put more people through it, actually start branching out maybe into Lean Office as well. We've been relentless since 2006 in our quest for continuous improvement. We've done 50 Kaizens since that time. This year alone, we did 28. So we're really starting. We've got some great momentum. We're starting to branch out as well, too. So we started on the production floor. Now we're going in R&D. So the R&D people are a little nervous. Quality assurance, you can't touch quality assurance. Oh no, we're going after them too as well. Materials group and the supply chain. We told our suppliers right up front that, hey, we're going to get our house in order first. And then we're coming after you, but we're going to keep talking to you. But now, once we get where we need to go, we're going to come out and we're going to start doing it. And we've already been out to a few suppliers doing some value stream maps and working with them. The suppliers who aren't buying into it, they're not going to be our suppliers in the future. Just some of our results. Our sales have grown by over 25% without any increase in headcount. Actually, our headcount's decreased a little bit. We've been able to deploy people in other areas. We've put team trainers on each shift. We've expanded our molding capabilities. We put people into that. And again, with the same level of people. Savings, $1.2 million. So we've done that since 2006. Our cycle times have been from 12 weeks to 4 weeks. Out of the 4 weeks, sterilization is 11 days. And sterilization is a critical process for us, being a medical device manufacturer. And that requires a lot of validation activities, FDA submissions. So we know we can reduce it, but it's going to take time. Space, and we've heard the other speakers talk about that. We're using 55% of our space in our clean rooms right now. So with the Lean, we've been able to really drastically reduce it. We also have a surplus of tables. If anybody's interested, see me afterwards. We use Lean as a competitive advantage. We get audited every 3 weeks by our customers. Since we're a contract manufacturer, we sell very little on our own. They're coming in and auditing us. And we have to be competitive in that aspect. The 5S, the Lean principles really help us with that. They keep it organized. It's really a competitive advantage. It's also helped us with our regulatory compliance. If you have a good 5S system, you're going to be that much better. We even actually had customers come in and audit us to Lean and Six Sigma. You know all the quality systems. You're certified. You're FDA regulated. You know that. Now we're going to start do a deep dive and try to get into that more. So that's key for us. We have to get better at that and continue. The other key thing is they don't want to pay for your waste. So when they come in, they see that we have Lean going on. We're attacking the quality issues for the Six Sigma. They know they're getting good value. They know that we're going to be relentless against our pursuit for continuous improvement. We advertise that as a manufacturing advantage on our website as well. Our operational excellence journey. If you haven't read Jim Collins' book, Good to Great, it should be a required read for any manager or leader. We strive for excellence. Good is the enemy of great. It's not good enough in today's competitive environment. We heard a little about that. 2 of GE's top Lean plants, one's in Mexico, one's in China, and they're doing some incredible things. So Lean is out there in the other countries, and we have to be competitive. In this environment especially, it's key for us. It has to be a way of thinking. It has to be the mindset of every employee. For us, we're going to continue pursuing our Lean and Six Sigma education. We're going to train, we're going to learn, we're going to do, and we're going to keep at it.